Hello, my name is Dr. Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday the 7th of October. And looking at our numbers today, we are showing 44 COVID positive inpatients, 38 on the hospital site here, 3 in Clifton and 3 in our intensive care unit. Just compare that to last week when we talked about 29 in the hospital, 3 in Clifton and 2 in ITU, so a total of 34 this time last week, 44 today. And in terms of our activity through the hospital, you know, we're seeing a clear, ongoing and significant worsening of the position as far as COVID is concerned. And I think that's borne out by the figures in our community data, which I often refer to, which are taken from the BBC website and show cases per 100,000 in Blackpool up to the 3rd of October of 165, whereas it was 70 this time last week. 131 for filed, whereas it was 100 last week, and for wire 119 versus 68 last week. So this clear, ongoing, significant worsening of the position seen across the community and in terms of the activity coming into our hospital. Last week I talked about the complexity of the case mix and the possibility that some people who are classified as COVID positive may be in hospital with other conditions. As I've looked at that data today, the update is that the vast majority of the patients who we're showing as COVID positive today are in our medical wards with medical conditions linked to COVID, and a number are in our cardiac centre. We have had children in and pregnant mums into the hospital over the last week or so who've been COVID positive, but we don't have any in those categories at this stage. So when we're talking about COVID positivity, we're really talking about people for whom COVID is contributing to the reason for their hospital admission. Because of the numbers being as they are, we have maintained our visiting restrictions, so we are still restricting to birth partners, for paediatric cases and for patients who are nearing the end of their lives. And there are other details about that on our website. When we've looked across our data about whether there is any flu circulating within the hospital, any influenza, at the moment we're not seeing any at all, which is comforting in one sense, but it's an amazing opportunity now to get a flu vaccination if you are in an at-risk category, because it's a great time to get the vaccine ahead of the arrival of flu, which will inevitably happen. It happens every winter. We are up to about 30% of immunisation across our own workforce, and that programme of course is progressing as rapidly as we possibly can. So I think the message is that we have to not only maintain our vigilance but probably increase it. The guidance really is not desirable but mandatory now, isn't it? There are legal reasons to wear masks in public spaces, to socially distance, to hand wash, and of course to abide by the rule of 6. So we're really moving into a very alarming phase of a second wave, and we all need to do everything we can to protect ourselves, to protect our colleagues and our families, and to protect our patients. Thank you very much.